Paul Irwin, Dean of the School of Public Health at the University of Alabama at Birmingham, and it is my honor to welcome you to this webinar focused on COVID-19's impact on women, a conversation with medical and public health experts. This is the second webinar of the COVID-19 webinar series sponsored by the UAB School of Public Health, with a focus on COVID-19 and vulnerable populations by holding interdisciplinary conversations between experts. Our first panelist is Dr. Tamara Coyne-Beasley, Division Director of Adolescent Medicine and Vice Chair of the Department of Pediatrics at the UAB School of Medicine. Our second panelist is Dr. Zoe Julian, an OBGYN physician and a preventive medicine research fellow at the UAB School of Medicine. This conversation will be moderated by Dr. Shaunt Saller and Dr. Faith Fletcher, both from the UAB School of Public Health. I will remind you that this discussion is being recorded and will be available on the School of Public Health's and the School of Medicine's YouTube channels a little later. Thank you all for joining us. Now let me hand it over to Dr. Shaunt Saller.
Thank you, Dr. Irwin. I'd like to set the table by dedicating this conversation to all women who are fearlessly making things work in the midst of this pandemic. Women like the late Fannie Lou Hamer and current Congresswoman Terry Sewell, who both challenged democracy vehicles that were jeopardized during the Civil Rights Movement and now with COVID-19. We dedicate this work to Indigenous women like Daphne Singing Tree and LaDonna Brave Bull Allard, who supported protesters at Standing Rock through healing wisdom and midwifery services. We also dedicate this work to local advocates and activists such as T. Marie King and Odessa Woolfolk, who have trained, taught, and marched against racism and stigmatization. Lastly, we dedicate this conversation to all healthcare workers, service workers, home care providers, grocery store clerks, restaurant owners, employees, and all frontline women throughout the world facing tough decisions during this unprecedented outbreak. And now I'll turn it over to Dr. Faith Fletcher.
Thank you, Dr. Allen, for acknowledging and honoring all of those women. So I'll start with you, Dr. Coyne-Beasley, to talk about women in COVID today. While COVID-19 impacts everyone worldwide, in your expert opinion, how are women in particular affected by this virus?
Well, thank you so much, Dr. Fletcher. I'd like to talk first about how women are impacted overall, and then more specifically about how they're impacted in regards to their health. Well, one of the things that we've certainly seen is that crises, disasters, and pandemics often highlight vulnerabilities and long-standing systematic and structural inequities in a society as well as globally. Not only do they highlight significant racial disparities whereby African Americans disproportionately die from COVID disease, but they also highlight other inequities, as we're talking about today, gender inequities. Disease outbreaks do impact men and women differently, although they impact us all. Although the social and economic impacts can be severe for both groups, many of the industries that are affected by our lockdowns or by quarantines affect women in larger ways because they actually make up a larger sector of those economies. For instance, women are more likely to be domestic caregivers, domestic workers. They're more likely to work in travel and tourism, restaurants, and food production. But they work in these industries at lower wages, if they receive wages at all. They generally will lack health insurance and not have a social safety net to fall back on. At the same time, women bear a greater burden typically in the care for others in their homes. While they're in their homes, they're not only working if they still have a job, they may also be juggling taking care of children, homeschooling, caring for the ill, as well as caring for other family members. Female-headed households in particular are especially vulnerable to significant losses of income as well as health issues.
Thank you, Dr.
Oh, I'm sorry. Yes.
No, thank you for those comments about women generally, but I just want to go back to something that you said about juggling these multiple roles. Can you talk about how that may impact mental health for women?
Yes. So there are lots of ways that it can actually impact women because as you're actually trying to juggle all of these roles, you may have some of your social supports lost. So you may develop more stress. You may become depressed. You may become anxious. That's not uncommon in situations of uncertainty. You may also lose your job and have real troubles and difficulties putting food on the table and having a roof over your head. At the same time, you're isolated from your social supports, your places of worship, and your friends. And so not only does it potentially impact mental health, it impacts physical health too, for very basic things. Because as we divert our healthcare monies and efforts towards the epidemic, we actually aren't going to be seeing people who need basic health care for immunizations, who need sexual and reproductive health, such as teenagers who might need contraception or who may also need STD treatment or screening. We also may neglect to actually have appropriate prenatal care such that young people or older people who actually are pregnant can actually have safe deliveries and not have an increase in morbidity and mortality, which is often seen in other outbreaks.
Okay, thank you for those comments. And I know we'll definitely expand on the issues related to birthing with Dr. Julian. So I want to return to the issue of violence against women during this time of social isolation and stay-at-home orders. Would you provide some more context about that and why it's important to discuss?
Yeah, so that's actually a really, really great question because some of the things that we have to do to quell the epidemic are the same things that put women at risk. So, for instance, social distancing provides isolation to women, particularly where there are stay-at-home orders or restrictions on the freedom of movement. They actually may put people in the homes with their abusers and not allow them to actually go out and get the social supports that they need. So it's really interesting that, many people may not even realize by the time we got to mid-April, half of the world's population was on some form of lockdown or quarantine. So what that did essentially was create a lot of different women, some who hadn't even experienced, domestic violence in the past, now being put in situations where there's a lot of tension, basic needs aren't being met, stress is there within the family, and they may be susceptible to not only domestic violence, but also other mental health concerns that are exacerbated by these very stressful situations.
Okay, thank you for that. So we know that all women are affected by COVID-19, and last webinar, we really honed in on the severe impact of COVID-19 on African American communities. So I would just like your thoughts related to the effects of COVID-19 on the health and well-being of African American women in particular.
Yeah, so I think the important part of that discussion that you had on your last webinar is you looked at health in the context of all that health is made of. So you looked at not only what we think about traditional healthcare, but also things like affordable housing and food. And in fact, many of us call that the social determinants of health. They're all the things in our lives that impact how we're going to feel, how we're going to even comply with the medical advice that might be given to us, and how can we be healthy and thrive from a psychosocial perspective. And so some of those things are incredibly important and again exacerbated. Why are they exacerbated for people of color? They're often exacerbated for people of color because none of us fit completely in one single little box. And in fact, women, particularly African American women, have intersectionality about themselves. So they're not just African American, they also are women. They may also be a person who's an LGBT or Q. They may also be infected with HIV disease or living with HIV disease. And so there are lots of things that can make up the person that they are and be a part of multiple marginalized groups that actually makes their discrimination compounded. And when you think about all that intersectionality that's there and available, it can actually exacerbate one's not only their health risks, but also their health disparities and their ability to access care.
Thank you for your remarks on that. So as we're thinking about women, we really want to make sure that we're centering the most marginalized women as it relates to this epidemic. So thanks for providing context on that.
Yeah.
And finally, Dr. Coyne-Beasley, I would just like to end with you offering some final remarks or advice for women who are navigating this pandemic.
Well, there are lots of things that you can advise people of, and particularly following the advice of the CDC, which is really to make sure that you wash your hands often and frequently, that you have social distancing, at least 6 feet between individuals. But you also need to make sure that you have self-care, and part of self-care is being aware of what's going on, but making sure you get good resources for your information about the epidemic. Sites like the CDC and the World Health Organizations are things that I would recommend. It's also important to, while you may be caring for others, to actually have some self-care for yourself, which includes things like prayer and meditation, still connecting while you're physically distancing, not socially discommunicating from your family, your friends, and your loved ones, and making sure that you are in tune with your own mental health. So people always think of mental health in a negative context. We all have mental health, just like we have physical health. Sometimes that mental health needs attending to. We all are subject to stress. So being mindful of what you are doing, how you're feeling, and then reaching out to others for resources. And I know that we'll be providing some resources at the end of this program.
Yes, thank you. One final burning question, Dr. Coyne-Beasley. Is it safe for women, in your expert opinion, to go to the salon right now?
You said beauty parlor, right? Or the salon. So the truth of the matter is, and I certainly understand the question, because that's one of the first places I want to go when it's safe to do so. And so what I would say to you is actually that at this particular time, I would say no. I would follow the advice of the CDC, which is actually to go out only for essential things. And as much as I would like to think that, going to the salon or going to the movies is essential, it really is not. So until we're able to dampen this curve, until we see the amount of disease going down in the population, and until our medical scientists say it's safe, regardless of what other information you receive, it would not be safe to go to the hair salon. And I have a couple of other things I just wanted to say about opportunities that I hope arise out of this crisis. If there are silver linings, what can they be? Hopefully it's helped us to rethink our priorities and what we consider to be essential, i.e. not going to the hair salon, but taking care of each other. Hopefully it's helped us to think more about future pandemics and how we might be better prepared. It also has, made it really clear that there are systemic and social inequities, and that we should work really, really hard to actually improve those inequities and, in fact, eradicate those inequities. And last, as an adolescent specialist and actually a person who works with women, I hope that we've learned also that the health and well-being of women and girls directly impacts the health and well-being of our children, of their children, and of future generations. And it's important that we invest in them and protect them and provide the services that women need, not only during pandemics, but at all times.
Thank you for your time and expertise, Dr. Coyne-Beasley, and really thank you for your service to the community, especially during this time. I'll turn the rest of the conversation over to Dr. Shaunt Saller.
Thank you, Dr. Fletcher, and thank you, Dr. Coyne-Beasley, for those comments. And this is a great segue into talking a little bit more about issues related to gynecological concerns as well as birthing issues. So Dr. Julian, from your perspective as an OBGYN, what is the impact of COVID-19 on pregnancy and birth outcomes?
First I'd like to say thank you to the panelists, my fellow panelists, Dr. Coyne-Beasley, to Dr. Fletcher and Dr. Allen, as well as Dr. Irwin, for helping moderate and host this, and for allowing me the opportunity to contribute to the conversation. With regard to COVID-19 and pregnancy, as much as there's uncertainty with regard to COVID-19 and its health effects amongst the general population, we are also contending with a great deal of uncertainty regarding COVID-19 and its impact on pregnancy and birth outcomes. Typically, with regard to recommendations that come from physicians and other healthcare providers, we use the gold standard of randomized controlled trials and high level of evidence to inform our recommendations. And quite frankly, we are still learning, and our information is still evolving in real time regarding our recommendations around pregnancy and COVID-19. So I think this provides a great opportunity for really invested shared decision-making between providers and their patients and pregnant people as we're all navigating this pandemic together. I can tell you that the data we have so far does not suggest that pregnant people are at any higher risk of infection with coronavirus, and also they're not at any higher risk for more severe symptoms compared to the general population. We do have information about similar respiratory viruses such as influenza and other coronaviruses, which we know do have a more severe impact amongst pregnant people. And so this information leads us to believe that we continue to recommend the same recommendations for pregnant people as we do with the general population. So as Dr. Coyne-Beasley already articulated, the importance of hand washing, social distancing, and if you are out in public, getting those essential needs met to make sure to be wearing a cloth, face covering, or a mask if you have that capability. With regard to the impact of coronavirus at different points in pregnancy, which I know are questions I'm often fielding from my own patients, we don't have a lot of information yet about the impact during the first trimester if someone becomes infected with novel coronavirus, or the second trimester. A lot of the data we are working from comes from the experiences of pregnant people, mostly in China, but also in other countries around the world, including here, and have really focused on treatment and management when someone becomes infected in the third trimester and beyond. Another area where there's a lot of question is regard to the ability to transmit the virus from a pregnant person to their baby in utero, so during the pregnancy, or during labor and birth. And again, we are in a bit of a gray area, but the evidence we have so far suggests that there's no evidence of virus in vaginal fluids of patients who are pregnant with coronavirus, or in amniotic fluid. And these are fluids that babies come into contact with during a delivery. So that offers us some reassurance. We do have some additional immunologic testing out of China with case studies showing antibodies in babies against coronavirus who were born to women who were infected with the virus. It's hard to say for sure if that's evidence of a transmission from the birthing person to the baby, or if there's potential for them to have been exposed to the virus after delivery once out into the world. And so again, we are in real time investigating these issues to be able to provide more comprehensive data and recommendations to our patients.
Thank you for that. That's really, very reassuring, as you said, to know that pregnant women are not at more risk for COVID-19, particularly as those who are thinking all these wonderful life moments that are happening. We certainly don't want people to be fearful of going and having their children. Can you also speak to how COVID-19 could or has impacted birthing plans for women?
Certainly. So I think this has been a topic of great conversation in the public media, especially looking at New York, one of the hotspots for our pandemic domestically, and changing policies amongst hospitals around visitation for pregnant people while they're laboring and birthing in the hospital. I will say that we have a unique challenge with regard to coronavirus and pregnant people who are delivering in hospital, and certainly hospital leaders and systems are attempting to balance what may be viewed as competing priorities, trying to balance ensuring the safety of patients who have come to the hospital, usually healthy. Pregnant people are often the most healthy people who find their way to a hospital, as well as healthcare workers. But I also think that it's really essential that leaders of healthcare systems really invest in creating protocols and policies that decrease everyone's exposure to coronavirus, but also helps to ensure equitable access to critical resources and supportive practices during birth. With regard to folks that I've cared for in real time, people are finding really creative and innovative ways to celebrate their pregnancies and to continue to provide social support to their loved ones who are going through labor, despite some of these policies. And so as we are all moving to a more digital world, people are celebrating baby showers using webinar platforms and video technology. birth workers such as community health workers and doulas, who often provide in-person real-time support to birthing people, are also taking advantage of different platforms for which to continue that support, which is critical, especially for birthing people of color, as well as being innovative with degrees of self-monitoring and community care. So I know of, not in my specific practice, but speaking with colleagues around the country, some folks are engaging in group prenatal care also via webinar, with home blood pressure cuffs and other monitors under the guidance of a clinician. And I think following the lead, quite frankly, of our communities around how we can be innovative in the midst of a pandemic also provides, I think, us an opportunity to think about our maternity care system as a whole. We certainly have evidence to show a great joint statement from the American College of Obstetricians and Gynecologists, as well as the Society of Maternal Fetal Medicine, and the American College of Nurse Midwifery, tells us that both hospitals and birth centers are safe places for people to birth. And I think this provides us an opportunity, the pandemic, to think about how we can more greatly support other places of birth beyond the hospital, especially during a time when the hospital may not be the safest place for folks to birth, as well as bolstering our overall maternity care workforce. So really thinking about expanding insurance coverage and scope of practice for nurse midwives, for nurses, for doulas, community health workers, lactation specialists, childbirth educators, all these different members of maternity care teams to really ensure the most equitable access we can and the most positive birth outcomes we can for all birthing people.
That's fantastic. I love that you talked about thinking about how the pandemic can really begin to shift thinking around how the whole system around birthing and child caring. And interestingly enough, I was at a virtual baby shower before we got on this call, and we did virtual baby bump rubs, and had an opportunity to scavenger hunt for things that actually had something to do with COVID-19. So it was a great time. Even though we weren't able to be together, it was really fun. Another question I have for you is, there are concerns that maternal mortality might be heightened by COVID-19's hospital policies. You mentioned a little bit of that, but can you comment on that, and particularly thinking about this from a reproductive justice framework?
Certainly. And I'd love to give a brief intro for those who are not familiar with what reproductive justice is. So reproductive justice is a framework that was developed by women of color during the 1990s to articulate 4 basic tenets around the intersection of reproductive rights and social justice. So those tenets involve the right to bodily autonomy and control over one's body, the right to have children, as well as the right to not have children, and also the right to parent and raise children and families in safe and sustainable communities. And I think using this framework really helps us to contextualize, on one hand, the increased structural inequity that may present itself during this pandemic, as well as give us a framework to consider solutions, keys to an equitable pandemic response that can help ensure, and as Dr. Coyne-Beasley said, eliminate disparity during the pandemic and beyond. I think one thing that is key is that we know prior to coronavirus that structural inequality impacts the health outcomes of Black and Brown people, including Black and Brown pregnant people. And I think it's really important, again, for our policy and health systems innovation to center the needs of those communities at this time in order to not exacerbate inequity. One important key, I think, to start is that we must collect data. Both Dr. Coyne-Beasley and myself are clinicians and scholars, and many of us on the call recognize the importance of data in this era as we try to understand patterns of infection and disease. It's important that that data is disaggregated by race. And I think when it's not, we run the risk of seeing potentially overall decreased rates of infection or disease for a particular community, population, state, nation, without understanding the potential nuances for different groups of people by race and ethnicity, given the structural inequity that already exists in our society. So that is a large push is happening now amongst scholars for that disaggregation. In addition, as Dr. Coyne-Beasley said, I think it's key for us to maintain, and I would argue even increase access to comprehensive sexual, reproductive, and maternity care services during this time, and to make sure that those are protected as essential healthcare services during a pandemic. Additionally, I think reproductive justice gives us room to consider policy initiatives that can help ensure safe and sustainable communities for people to raise their families. And things like paid sick leave, family and medical leave, hazard pay for essential workers, sufficient support for the childcare sector, which has great impacts for women during this pandemic, enhanced protections for pregnant workers at various different jobs, as well as considering things like rent and mortgage freezes, cancellation of discontinuing key utilities. All of these things are critical for folks to be able to care for themselves during the pandemic, follow the recommendations of the CDC and the World Health Organization, and ensure that we all make it through the pandemic as healthy as possible.
Absolutely. Those are all of those things that you mentioned, so critically important for everyone, and particularly for those who may be, in the midst of a pregnancy or on the tail end of that. One last thing I wanted to ask you was just to comment on kind of this intersection of marginalization. You mentioned that it's important that data be deaggregated by race, and that we need more accurate data in order to really be able to plan effectively and make informed decisions about how we respond to COVID, particularly as it relates to women. But can you speak a little bit to women who are in marginalized subsectors, such as those who might be, who are living in poverty, those who identify as LGBTQ, and is that more pronounced or heightened during this pandemic in terms of risk, or just can you speak to that?
Yeah, certainly. I think the simple answer is yes, that those inequities are compounded during a pandemic, and that as you spoke about different intersections of identities and particular ways that folks who are, for example, both women of color and living in poverty while also being an essential worker, potentially, let's say, in a multi-generational household, your ability to socially distance when you have both your grandmother, your child, your partner, and maybe another family member all in the same household is very difficult. If you're someone who is part of the working poor and considered an essential healthcare worker or an essential worker in general, who may or may not be getting appropriate PPE at your place of business, that again puts you at an increased risk. If you're someone who is marginally housed and has intermittent access to clean water, again, another example of a person who's going to have really great difficulty with hand hygiene. So all of these different intersections provide many concrete examples for how risk is heightened. And as a result, our response must consider these types of intersections when we're creating innovative solutions during the pandemic.
One of the things that I think is really important when we think about intersectionality, and Dr. Julian actually touched on some of that, is that we need to also think about the most marginalized. So for instance, one of the strategies for a lot of things, whether it be education or healthcare, has been, virtual. But there are still people in our communities, including in Alabama, who don't have access to internet, who don't have computers, and who don't have cell phones. So what are the strategies that we're actually going to utilize to actually be able to engage them in the participation of their healthcare, whether that be maternal healthcare or otherwise? How are we going to engage those children in their schools? So these are additional stresses that women and families who are the most marginalized and on top of poverty have to deal with. And I think just as Dr. Jillian said about the families who not only don't have running water, but it's not clean water when they have it. And for the people who don't have good sanitation. So there are lots of things within strategies that just aren't available to everyone based on the social situations in which they live in. If you don't have running water, you can't wash your hands for 20 seconds. And as she said, in places, whether they be urban or rural, you can have people in a dwelling that really doesn't allow for social distancing. So one of my hopes is that we actually don't go so far to all the virtual reality and forget about the human contact that is needed to help us heal, to help us connect. Human beings are social bodies. And so while we've done a lot and made a lot of transition to virtual reality, I hope we don't forget, particularly when we start thinking about how we can do things more efficiently and cheaply, to remember that there is something that comes from that human interaction. There is something that comes from the relationship, and that it's really important for us not to lose sight of that as we transition out of this epidemic.
I just want to follow up with something that you mentioned earlier in terms of sexual and reproductive health for adolescents, Dr. Coyne-Beasley. So can you talk about how to have safe sex during this pandemic? It's a question that, we're having a lot of dialogue about. There have been some reports that have been released. We're talking a lot about physical and social distancing, but the reality is people need to have the tools, and they need to be equipped to stay safe. So can you provide some insight related to that?
So when we think about sexual activity, clearly that's a very broad concept. And the very first thing that people will think about is that truly, if you're in a position where you're supposed to be having social distancing at least 6 feet, sex really isn't a safe thing to do in that particular time. So in the heightened pandemic, sex is not something you want to do with anybody who's outside of your household. And part of that has to do with, one of the things that Dr. Julian mentioned is we know we have not been able to identify the virus in vaginal fluid or semen. So it's not the act of sex or the sexual intercourse or the sexual activity, heterosexual activity, I should say, that causes the issue. It actually is the respiratory droplets that can be present in the mucus and in the saliva. I can say, however, that there has been some virus identified actually in feces, so it can be transmitted that way. So in fact, sexual activity, particularly if someone is sick, should never happen. And while you're in a pandemic, you certainly don't want to engage in sexual activity that will result in the exchange of saliva or oropharyngeal, mouth and nose secretions, because that can actually increase your risk of getting COVID disease. I do want to talk about something else because you've put it in the context of adolescents and young adults. Well, as I talk to you a little bit about this virtual world and virtual opportunities, young people and older people have the opportunity to actually undergo sexual harassment through cyber violence. And so you'll have, and you may have heard of some of the recent cyber stalking, where people have received unwanted sexual advantages, unwanted sexual images as they're trying to engage in social media and even chat rooms. So when we think about sex and how it happens in many different venues and has many opportunities to be abused. We also know sometimes that trafficking and sexual exploitation goes up as well. But in terms of the sexual interaction between two people, you can transmit COVID, not as a sexually transmitted infection. But again, it's important for people to know that sex during the time of a pandemic with COVID is not a safe thing to do. It comes with some risk, primarily through the oropharyngeal secretions.
Thank you, Dr. Coyne-Beasley. We've had a question that's coming in from some folks who are joining us Facebook Live, and I'm going to address this one to Dr. Julian. You mentioned in some of your comments earlier about antibodies, and so one of the questions that came in the babies with antibodies, when was the blood actually drawn? Was it drawn at birth or further in the postpartum period? And then also, is the immune system compromised? Those are a couple of questions that came in.
Yeah, great questions. The timing of the testing and the testing itself is key in our ability to interpret these results. And the baby's blood was tested within the first 2 hours of life. And both of these patients who had coronavirus were delivered via cesarean delivery. So that allowed the opportunity to test babies right away. In addition, important to note, the antibodies that were detected are IgM antibodies, which are known not to pass through the placenta. So that's another thing to consider with interpretation of these results. However, in those same babies, when they were tested for actual evidence of coronavirus itself in different tissues, there was no evidence of the virus itself. And so that puts us in this interesting conundrum about, is it possible that there was exposure to coronavirus, but not actually transmission of the virus itself? And neither one of those babies became sick while they were in the hospital after delivery, and are still being followed in real time as far as how they're doing now since returning home with their families. And another thing to consider as well with these serologic tests is they're also very much prone to false positives. So it's hard to know if those detection of antibodies were in fact true antibodies to SARS coronavirus 2. So that is just some of the conflicting data that we have at this time, trying to interpret and understand the risk of transmission from birthing person to baby.
I think Dr. Coyne-Beasley wanted to clarify a couple of comments that she had made earlier, so we'll let her do that.
Well, it was just one thing, because I want, as I listen to Dr. Jillian talk, I want to be really specific about transmission versus finding the presence of antibodies or virus in a particular place. Now, I mentioned to you that we have found, well, investigators have found the virus in the feces, but there is no evidence of transmission through the feces. That's different than actually finding the virus in the saliva and the respiratory droplets, which can be spread through mucus. So I want to be clear that just because you find something somewhere doesn't necessarily mean that it offers, confers transmissibility. In this particular instance, when we're talking about sexual activity between two people, you're worrying primarily about the saliva and respiratory droplets.
So I'd like to follow up from some of your earlier remarks, Dr. Coyne-Beasley, about really centering women in this pandemic, and in particular, violence against women, women's mental health. So related to that, how are children impacted and adolescents really being impacted if their caregivers are really dealing with some of these issues? Can you speak to that?
Sure. One of the things that you can imagine is that it actually heightens the anxiety of young people when they see their parents, particularly if their parents are engaged in violence, such that they themselves may be fearful that their parent can be harmed. And in many instances, they're worried about their own safety. In vulnerable situations like this, where money may also be an issue, and if there are issues with power and control, they also may be worried about whether or not they'll have a home and a place to live. They may, in fact, be ejected from their home with their mom. So this can create a lot of anxiety for young people, and it can actually create harm, not just mental harm, but also physical harm. And so when you think about violence against women and girls, children are a part of that. And in fact, when we've focused a lot on violence against women, but one of the things that often happens, and that was a real concern for me when school closed, was not only that some children would no longer have their food sources for their lunch and their breakfast, which would be the only meals they might have during that day, that they may be going back home to communities and houses where they actually are the subject of violence and not being in a safe environment.
Thank you. Thank you for that insight. Very helpful. And we definitely need to continue to make those connections between women and children. Thank you.
So I just kind of want to throw out a couple of questions here around, and Dr. Coyne-Beasley just mentioned about school closures and how that has impacted women and children. We certainly know that school closures have put an additional strain and demand on women and girls. The need for childcare provision, the opportunities are limited, and safe childcare is essential for those who are essential workers or who can't work from home. Dr. Julian, and I want to pose this question to you. Can you speak to issues just around, potential, how women of color may actually be kind of bearing the brunt of these issues around school closures, being at home, may not have the ability to be at home to homeschool their children, et cetera. If you can speak to that, that would be great.
Yes, certainly. I think one of the statistics I recently learned is that when we consider who we designate as essential workers, we already named some of them in the dedication, folks who work in food service, grocery stores, sanitation and janitorial staff at a number of different locations. The majority of those people are women when you look at nationwide surveys and census data. And the majority of those women are women of color. And so when we consider who has the capacity to work from home, to continue in their employed position and be able to socially distance and self-quarantine, women of color who are filling those essential roles often don't. And in addition, if they have children who, as Dr. Quinn Beasley was talking about, who are attempting virtual learning and require childcare, people are put in a very difficult position where often they have to either forego the ability to supervise their children appropriately and contribute to their education, or forego their jobs. And that's why I think really a strong consideration around paid family leave, paid sick leave, hazard pay, as well as appropriate PPE for all essential workers, not just healthcare workers, is a really important part of our conversation to help lift that undue burden. Also considering the ways in which a loss of employment has impact on a family economically. I think that's also why provisions like rent freezes and utility holds and other things, other costs that put burden on a family also need to be suspended and considered during a pandemic. And that type of crisis response helps to support people who are already at an undue burden, pandemic or not.
Thank you for that. Dr. Fletcher?
Along different lines, we're talking about this pandemic, and Dr. Coyne Beasley, I know you mentioned some experience doing work globally. So in conjunction with Dr. Julian's question in terms of the global impact and PPE, can you speak on your experience with that and thinking about some of the similarities between your global health work and what's happening here domestically in the US?
I think some of the similarities are really just the difficulty containing the virus within communities that are marginalized and low resourced. And again, remember, marginalization is not just a person of color. There are people who are not people of color who also are marginalized and have low economic opportunities. And so not having the opportunity to utilize all the equipment that you need, not having the opportunities to keep yourself healthy, because good sleep as well as good and healthy food and exercise, they're all a part of the ability to get better and to get well from any pandemic. And so when you are in a mission situation where you are low resourced, or you're in another country that's low resource, the bottom essentials are needed essentially no matter where you are. And oftentimes those individuals who are most resourced recover better. And again, I think the thing that's important in what Dr. Jillian is also saying is that it's not just about the actual health care that you provide. It also has to do with the essential services that wrap around an individual, that support them and that lift them up, whether it's providing good housing, safe environments, job security. I think the other thing, or certainly supplements to their job should they not be able to work at that job. But I think the other thing I just want to emphasize, because we focus so much on women, is that I don't want people to feel like this is just a problem for women or just a problem for marginalized women. When we have any segment of our population during a pandemic or any time that does not have good health, or particularly from an infectious disease, it allows the disease to continue to manifest itself. all throughout the population. So whether we're a man or woman or black or white or rich or poor, we all have something to gain by helping the least of us. And that is because this virus doesn't discriminate. And so I hope we use this as an opportunity to uplift everyone, because we talk about intersectionality, we're also interconnected. And if you're standing beside me and you're my essential worker, and you may be that person who has lots of marginalization, it's not going to just stay with you, even if I am the most privileged individual. So I'm hoping it'll help us, whether we're doing mission work across the ocean or in the United States. We're all interconnected, as we saw how well and how quickly this virus spread.
Thank you. Very insightful remarks. Dr. Allen?
Sure. Dr. Julian, I know you had a couple of things that you wanted to follow up on from Dr. Cohn-Beasley's comments, and then can I go ahead and pose this question to you? We can do it kind of a twofold thing. So we had a question that came in from Facebook. They want, someone mentioned that they would like to talk more about menstruation during this time as well. Items such as toilet paper, individuals stocking up on menstrual items like pads and tampons. What other options or resources are there out there for women who are menstruating when local stores may not have what they need? So you can certainly follow up to Cohen-Beasley and then respond to that question.
Certainly. So I so appreciate Dr. Cohen-Beasley hammering home the importance of, when we center those who are most marginalized, most vulnerable, we actually improve care, outcomes, and societal structure for all. And I think in our efforts to center those communities, it's also key for us to go to those communities for their expertise around their experience and what solutions would serve them best. I think too often, those of us, myself included, amongst healthcare leadership, academic institutions, research infrastructure, that we have our own scopes of expertise, and recognizing that in the course of a pandemic, especially those communities who have had to overcome structural inequity for so long, they have generated their own expert solutions to navigating these problems. And certainly during a pandemic, that's an expertise we should lean on. To answer the question that was posed on Facebook regarding menstruation, yes, I'm so glad that someone has asked this question, because there are other menstrual products available for people who are menstruating when pads and tampons are no longer in stock or hard to come by. One such product is something called a menstrual cup. Diva Cup is a common brand that many people are familiar with. And these cups are medical grade silicone that are safe for internal use. They're reusable. You're able to insert them similar to a tampon, and can be cleaned once they become filled during the course of a menstrual cycle. They're fairly affordable, usually somewhere between $15 and $30 for a single cup that can last for, I think, at least 1 to 2 years. So it can be a much more affordable option than pads or tampons for folks who are menstruating, again, whether you're in a pandemic or not.
I'm going to toss a question to Dr. Cohen-Beasley, just to follow up on a couple of comments that you made earlier around, seeing this increase in cyber violence and stalking. Can you speak to that a little further in terms of increased domestic violence as a part of the COVID-19, unfortunately, behavior? I've seen some comments in news articles where landlords are asking women who are paying for their rent, for sexual favors when they come to do that. Can you just speak to, that issue around domestic violence as in the midst of this pandemic?
Yeah, and so you provided a really great example there. There are several. I mean, there are also examples where a person may be in remember, intimate partner violence does not necessarily mean that they live with you, but you may be engaged in a relationship with a partner, and that partner requests images of you that you think are going to be just shared with that individual. And in times of social stress or times when they need to exert control or money, they can actually threaten to utilize those things. And so we're seeing that not only in terms of normal everyday life, and so that's why it's really important for parents to monitor their children's email exposure as well as social media exposure. But it seems to be heightened during periods of crises. One of the things that people have talked about and heard a lot about is sex trafficking. And oftentimes I've heard of multiple stories where young people are actually trafficked, not even realizing what's happening. They may be engaging or responding to an ad that asks for them to be a model or a babysitter. And then they go to the place or the location, and then they are then found to be put into the slave trade because they responded virtually to an ad that seemed pretty unrisky at the time. And so it's just, people are incredibly creative, and sometimes that creativity is in negative ways. And really the internet has become not only a good way to ascertain goods and services, but also a negative and deceptive way. And when we think about even that, know that during crises, people are also perpetrating scams of many kinds. So while they may be domestic violence related scams, they can also be scams where people are trying to take advantage of individuals, whether it's for sex or whether it's for monetary gain. And for some people, it's even just for pleasure. So there was one other thing I wanted to add as it related to menstruation, which is a significant issue that impacts young people or young girls. And one of the things that also is available in addition to the vaginal cup are actually reusable sanitary pads. And I was actually supposed to go on a mission in March that was actually canceled because of COVID. And one of the things that our organization did, our civil organization that was actually organizing this trip with a church, was to actually make and sew reusable pads. And so one of the things that's happening a lot in the community, and we're really grateful for our community members who have been sewing masks that people can use, there are also patterns and ways that we can show individuals how to make reusable pads. And with these reusable pads, you can really essentially use them for as long as the seams are available and they stay together. So there are many things that people can use, but menstruation is an important thing for young women, particularly young women in non-industrialized countries, because if a woman is menstruating and doesn't have materials, she can't go to school because she may not even be able to work. So it's really important that we have a lot of options for young women's health.
Thank you, Dr. Coyne-Beasley. So this next question that's coming in is for Dr. Julian. If a mother has the coronavirus, does the baby have the mother's antibodies at birth? Is the baby protected from the virus?
Great question. And unfortunately, the answer is we don't know yet. Similarly with even adults, this question is also posed for adults who've been infected with novel coronavirus. And we yet don't understand how the antibody response that is mounted to their own infection, if that provides them immunity to become reinfected. Or if it does, for how long does that provide them immunity? And so those same questions exist for babies who are born to birthing people who have been infected with coronavirus. I will say something I wanted to touch on regarding risk of infection or transmission between the new birthing parent and their child postpartum. A lot of folks have asked about breastfeeding or chest feeding, if that is still a safe practice for a person who has been infected with coronavirus or tested positive. And the recommendations, again, are around shared decision-making conversations between folks and their providers. But if and when someone does choose to breastfeed or chest feed, to make sure to wear a mask and continue good hand hygiene, or even hygiene, cleaning of your chest before the baby actually makes contact with the breast. Because again, as Dr. Coyne-Beasley has talked about, it's the droplet in contact that really increases the risk of exposure and transmission for a new baby.
Thank you. Thank you, Dr. Julian, for that important information. And thank you for the question from the audience.
Just one person mentioned on Facebook in terms of PPE that there are Health Connect South is actively building out a comprehensive directory. Thank you, Abira Wilson, for that information. We'll certainly add that to a list of resources that we're going to collect and catalog for a portion of this at the end of the program. Dr. Fletcher, I'll hand it back over to you.
So I think thank you all for logging in today. We're really excited to have these conversations that really center marginalized and vulnerable populations. And it's an honor to have these conversations in such an interdisciplinary manner between medicine as well as public health. And we hope to continue these conversations. I just want to highlight that this recording will be available next week via YouTube through the School of Medicine as well as the School of Public Health. Thank you all who joined us today. Thank you for your questions, and we hope that you continue to support our initiative to have conversations about COVID-19 and vulnerable populations, and have a safe and wonderful weekend.